Good evening, everyone. I'm Dr. Carol D. Birks, and I am the proud superintendent for Chester Upland School District. And we want to welcome you to our community forum this evening. The purpose of this forum, which is in partnership with Chester Upland School District, the Policy Lab at the Children's Hospital of Philadelphia, and the City of Chester, is to focus on a discussion for participants to learn more about COVID-19 from its origin and transmission to the available vaccines and testing measures that are available. We are so excited this evening to share with our community some greater insights as it relates to COVID-19. And so at this time, it gives me great pleasure, one, to share with you as a community, we are focusing on the core, children first, one Chester Upland School District, reimagining our district, and equity and access and social emotional learning for all of our learners. We are looking forward to welcoming back our, our learners. We are in phase 3 of our school reopening plan. So on March 2nd, everyone say March 2nd, who's listening? Woo, March
March
2nd.
2nd.
Yes, we will have our students from grades 3 to 12 to return to in-person learning. We have 2 cohorts. One is cohort C, in which those students who are in cohort C, they will report to school on Mondays and Tuesdays. And the students who are in cohort U, they report to school on Thursday and Friday. Now, Dr. Birks, what happens on Wednesdays? Well, on Wednesdays, our students will learn in the morning, we call synchronous learning, with their teachers. And then in the afternoon, our teachers will engage in learning because we're in the learning business. And then in the afternoon, the students will engage in what we call asynchronous learning. So they'll have projects and all those wonderful things when they are involved in independent learning. We are excited about the work we have underway. And after we have this discussion, we're going to invite you to our website where we have uh, equipped everyone with a what we call our Ready to Learn and Accelerate plan, which has all the details of all of our protocols and practices in which we will engage in order to keep each of us safe. So we are excited this evening. I get the unique opportunity to introduce my boss, Dr. Juan Bond. He is the receiver for Chester Upland School District, and he's going to bring us some greetings this evening. Dr. Bond, let's give a round of applause for Dr. Bond.
Nice job, Dr. Birks. I just want to say welcome to everyone that's with us this evening. I'm excited about this opportunity that's being provided for us, and I want to thank all the participants and everyone who helped put this evening together. We're going to listen and we're going to learn, and then my hope is that we listen and learn and then do. Listen, learn, and then do something. So thank you, Dr. Birks, and thank you for all that you've done and all that you're doing.
Thank you, Dr. Bond. And I
Mhm.
want to also acknowledge all of our families who are listening and our board members, of course, our students who may be listening now. And, we've laid as our foundation, our core, as I mentioned, and we're focusing on one Chester Upland School District. And so I'm really happy this evening that we're able to strengthen our partnership with the city of Chester because we are one Chester. And so I have the distinct pleasure to introduce our Honorable Mayor, who will come and give some greetings this evening. Our Honorable Mayor, Mayor Kirkland. Okay, so we will invite the mayor. As we know, sometimes with Zoom, we can't get on as quickly as we would like. And so at this time, we will have and I feel really honored to introduce our moderator for this evening. Our moderator for this evening is Dr. David Rubin. He is a nationally recognized pediatrician. He's the director of the Policy Lab at the Children's Hospital of Philadelphia. He has written over 80 or more manuscripts. He is a thought leader. He is an expert that superintendents and others throughout Pennsylvania and nationally are looking to for his guidance and his wisdom as it relates to the scientifically research-based practices as to how to keep us all safe as it relates to COVID-19 and other medical matters. And I get to hear him once a week, and I'm just like the students, I'm like sucking up all the information so I can learn, so I can be empowered as your district leader, your superintendent, so that we can put in the practices and research that's in place to keep us all safe. He's also was the brainchild in bringing about ACID testing throughout Delaware and as well as uh, all the other counties. It's just about that. I was going to say just Delaware County, but Chester County and Philadelphia, as well as all the other various interventions to help mitigate COVID-19 in our area. So without further ado, I'm distinctly honored to introduce Dr. Rubin. Dr. Rubin, thank you.
Good evening, everyone. Dr. Birks, thanks for that introduction. I just want to recognize, just what a pleasure it is to be here tonight to work with the Chester Upland School District. I mean, it's there's nothing more thrilling than to see a school district like yours get kids back to the classroom safely, and this is really why we do the work. I want to recognize, while you gave me a lot of congratulations for the work that I've done. It's truly been a group effort. Dr. Coffin, who I'll introduce in a moment, has been a partner all along the way. Sophia Collins is going to help me moderate today. Is a nurse who's been working with us, and particularly with your district, to really advance discussions about how we're going to get kids back safely and with testing to make sure that schools can move on the way they need to. Maggie Eisen, our implementation lead, who's really working tirelessly across the counties. And then Jeff Pennington, our informatics officer, is making sure all the data lines up and that we are making good on our promise to ensure that we're coordinating correctly with our public health authorities. So thank you for joining today's conversation. We're focusing on COVID-19 virus testing, the virus itself, what we know about the virus, what testing means in the context of the virus, vaccination, and how we're going to navigate the remainder of this school year amid the pandemic. And I think we're going to try to be really basic about it. Make sure we answer your questions out there. We're approaching a year now at the 1 year anniversary of what, for all of us, I'm sure, is a lifetime memory now at this point, and a sobering memory in terms of the many lives that have been lost here in the United States, and I'm sure have impacted your community as well. One way or another, the virus has affected us all, whether through infection, job loss, the death of a relative or a friend, or anxiety. Recently, though, I think there's a lot of optimism out there, and I think you're going to hear about that tonight in terms of the declining trends we're seeing and the opportunities that now are in front of you. We have 2 vaccines that have been granted emergency use authorization, and we've had over 40 million people who have been vaccinated safely now in the country. And we're going to dive into the conversation with the anticipation to educate you, inform you. No question is out of bounds, and what I hope will end the evening by providing hope for the residents here in the city of Chester. I myself, I'm the director of policy lab at Children's Hospital, a research center within our research institute at CHOP, and also the co-director, along with Dr. Coffin, of Project ACID, assisting childhood education through increased testing. We're talking about COVID testing. I'm thrilled to be joined by a great panel that really reflects your community tonight, so we can talk about the basics of COVID and mitigating or decreasing risk and transmission, when to get tested, what to know about the vaccine, the need to revamp our schools, and health equity, and even more. And we know that, I think we have to acknowledge right from the start that we know people are anxious. We're all worried about sending our teachers and students back to school and safely navigating in-person instruction. But I can tell you, based on a large body of work and the information that we've been tracking extremely closely, is that these protocols, these multi-layered safety protocols that the CDC talks about, that we've been working with schools around the region on, they're becoming more widely available. Our public health departments are assisting, and they're really helping schools get back to operations safely. And we're assuring that we minimize the risk that there'll be any transmission while people are in the schools during the day, and that's the most important thing. These multi-layered safety plans have an experience now well back into the fall. We watched them as they worked extremely well throughout the country, even up into New York City and some of our large cities, protect our students and teachers, even as the communities around them struggled in terms of some of the transmission outside of school. However, we've got to build some trust among the teachers, our families, our school administrators, and we have to address the concerns of families and communities that have been disproportionately impacted by the pandemic. Here at Policy Lab, we've been maintaining our school opening re-guidance in summer, and we ask you to go visit our webpage at www.policylab.chop.edu. You can see all the information we provide. We have guidance for school operations throughout the pandemic, incremental strategies for opening schools, recommended interventions for our K-12 schools. So there's a lot there for you. And we know that in our audience today are parents, teachers, public health professionals, school administrators, and community leaders and members. And we hope that today's discussion will help every one of these stakeholders consider the issues, decisions, and tensions that are at play in navigating the rest of the school year and ensuring that the community remains safe. A couple of reminders for folks listening in. All attendees' lines will be muted and video will be disabled throughout the event. We will begin by asking each panelist a question to get their expertise on numerous issues, and then we'll quickly turn to a moderated Q&A. Sophia Collins, our lead nurse in the ACIT program, is going to help me on that. If you'd like to submit a question, you can do so at any time using the Q&A feature located on the right-hand side of the platform. Let's dive in. So we're going to first introduce our speakers. First up, we have Dr. Messam, a pediatrician and owner of Media Pediatrics. She's double boarded in general pediatrics and child abuse pediatrics. Like myself, I share those double boards with her as well too, and she's worked the last 2 decades in Delaware County. Dr. Messam is also the founder of Every Child Counts, a nonprofit organization whose mission is to improve the life of at-risk children from birth to 18 years. For today's discussion, she's going to focus on addressing the importance of why children need to get back to school so critically and the implications of the delays in terms of returning to school that she is witnessing in her own practice, as well as what is documented in the literature. Next, we have Dr. Susan Coffin, the co-director of the ACIT program. She's professor of pediatrics in the Division of Infectious Diseases at the University of Pennsylvania School of Medicine, the Children's Hospital of Philadelphia. She's also a medical consultant in the Division of Disease Control for the Philadelphia Department of Public Health, where she's supporting COVID-19 response for the city of Philadelphia. She wears so many hats and has a wealth of knowledge, but for today's discussion, I've asked her to focus on providing the basics about COVID. So because there's so much information, some of it true, and some of it not true out there, and she's going to give us the skinny on what we need to believe and what we know is true about COVID and the interventions we're doing. And then finally, we're honored to have Dr. Christopher Hannam, who's an internal medicine physician specializing in addiction and obesity. He's a prominent face in the city of Chester and has worked within the community for over 30 years. He's on the board of directors for the Chester City Health Board. Dr. Hannam is going to focus on building trust within the community and how we can address vaccine hesitancy among adults in the school and the community at large. He will share current initiatives the city is doing regarding testing, vaccine distribution, and other efforts. So let's go. So I'm going to start first with Dr. Coffin. Let's just start with the basics, Dr. Coffin. Talk about what we've learned over the course of this pandemic about how this virus is transmitted and how that informs how we're trying to protect students and school staff in the school buildings.
Thanks, Dr. Rubin. I really love this question because it encapsulates, I think, so much of what we've learned over the past year and have learned works. We know now how this virus is transmitted 99% of the time, and that's through these things called respiratory droplets. We also know that there is a theoretical chance that we could pass the virus accidentally through contaminated surfaces. And then last, there have been some reports of transmission of this virus over longer distances through something called aerosols, incredibly fine sprays of virus. Those observations are really restricted to very specific situations where people are working in industrial settings or in delivering fairly sophisticated medical technical care. So for each of these different interventions, or each of these different modes of transmissions, we have a well-established way to block that transmission, and oftentimes multiple ways to block that transmission. So for droplets, those are best taken care of by just putting a barrier between where they come out, your mouth, and where they could cause problems, your colleague's nose or mouth surface. So if you put on a mask in front of you and your colleague has a mask on it, you've got a double barrier there, catching respiratory viruses. If you also know that respiratory viruses can only travel about 6 feet maximum in air because they actually have some weight to them, even though they're almost invisible, then you know that we can keep ourselves safe by staying farther apart. 6 feet apart almost guarantees the fact that we will not have a respiratory droplet move from me to you, even if we don't have our masks on. We talked a little bit about the possibility of contamination of a surface leading to infection. But by and large, if that's going to happen, what's going to happen is you're going to touch something, perhaps like a pen that somebody who was very ill had just used and somehow got very heavily contaminated with their respiratory secretions. If you were to touch that pen and then go ahead and touch your eyes, nose, or mouth, you could transfer virus. But if we keep on remembering not to share items and to clean our hands, then we have excellent protection against that way of transmission. And then last, airborne transmission is really protected against by staying out of settings where aerosols are generated, such as medical settings and specialized industrial settings. It is this type of transmission that leads people to talk a little bit about increasing ventilation, and just the mere movement of air dilutes and disperses any aerosols that are present. And it really takes very little to accomplish this. Even those fans that look incredible that they could protect us from coronavirus actually could do a lot to protect against coronavirus. And so that's how I think about our transmission and correlates of protection. And as Dr. Rubin said, it's really about layering one on top of another, knowing that at any given moment, somebody might have to take off their mask to have a sip of water, but that we've got many other ways to keep ourselves safe during that moment. So with that, I'll turn it back to you, Dr. Rubin.
Yeah, thanks, Dr. Coffin. People who know me, I can sort of cut to the chase in some ways, and I think we're going to have a very honest conversation tonight, and we're going to start, certainly Dr. Coffin was honest too, but I think you're going to, for Dr. Hannam, I think I'm going to launch right into a very challenging question. Aside from the disproportionate impacts of who actually has been impacted during the COVID pandemic, particularly families of color, there's a long medical history here of mistrust in the healthcare system that's justified, from the Tuskegee experiment to the exploitation of Henrietta Lacks when her tumor cells were harvested without her consent and used in biomedical research. And I think that's sort of the elephant on the table, if you will, in terms of interpreting our trust in whether, when we hear news about what we should be doing, or particularly around vaccines, how do we build trust in communities to believe in the value of these vaccines to be the road out of this crisis?
Well, thank you, Dr. Rubin. That's a very good question, and that is historically accurate. There's been a lot of distrust in underserved communities regarding medical research and medications to treat various illnesses. And this is a very challenging time. And this is an opportunity to, correct some of the ill will and some of the wrongs that were done to communities of color in the past. One thing that I thought was very important was that last year in the summertime, I thought it was very important, and I was very gratified to know that the University of Pennsylvania, one of the NIH research centers conducting their phase 3 clinical trials, they made a concerted effort to reach out to communities of color like Chester, Pennsylvania, to try to enroll its citizens in the studies, to have representation in the vaccine trials. And in the past, citizens of color have been underrepresented in many of the important clinical trials. And University of Pennsylvania did reach out and through the City of Chester Health Board and other local agencies and tried to recruit members from the community to participate in the studies. So that was a positive thing. And regarding the treatments that are available, including the 2 vaccines that have the emergency use authorizations, I think it's important that trusted members of the community, particularly the physicians in the community, particularly the primary care physicians in the community, that patients may have had a long-standing patient-physician relationship with. Physicians who are trusted in the community have been pillars of the community for many years. I think these persons need to promote some of the treatments that are available now and to give their own experience with it, and actually go out into the community, for instance, into the churches or into various community centers, senior centers, and reach out to the people and try to allay many of the fears that are there in the community. I personally, I did receive 2 doses of the Pfizer COVID-19 vaccine last month, and I'm happy to report I had no adverse effects, and I try to encourage my patients and others to strongly consider getting the vaccine. And we're trying to develop this herd immunity. So we do need 75-80% of the population to participate with the vaccine program, and I'm committed to doing everything I can to reach that goal.
Thank you, Dr. Hannam. So now, Dr. Messam, you're on the front line. As a pediatrician who's been serving Delaware County for such a long time, what are you seeing out there with the kids from a year of isolation, being out of school? And how's that influenced your opinion about the importance of getting our kids back safely into school for instruction? And then how can parents prepare their children for returning school while they're trying to keep them safe?
So those were a bunch of different questions, and I'm going to try to hit all of them. And so at the beginning of this pandemic, I absolutely was all for isolating. Everyone should isolate themselves. We just needed to survive. And then as the year has gone on, and I realized, wait, this isn't going anywhere. And then you start to see the stresses in the kids. The biggest group that I see stresses in, of where they're different in different ages, but my teenagers, the increase in mental health issues, suicidal ideation. I had 5 kids hospitalized in psychiatric hospitals at the same time in different places. And I've never, in the 20-something years I've been in this county, encountered that. Anxiety has gone up, depression has gone up. The kids are verbalizing, feeling isolated, feeling, as one of the teenage young men said, I'm lonely, I miss my friends. School, if teachers ever wondered if they had an important job, now you have a crucial job. Schools not only provide academics to kids, they get social skills, they have emotional skills in school. There are people to support those needs. They have physical therapy, occupational therapy, speech therapy. Kids will usually identify a teacher, a loving teacher, or a guidance counselor as their emotional support person over a family member. There's some kids that go to school and get good meals in school when they're outside of school, they have trouble with food securities. Some kids have trouble around the nation, not only in Chester, with the devices that they need to connect remotely. So I think it's crucial that we get kids back into school in a safe way. In terms of trust with the community, I just wanted to touch on it. It's not only people within the community, we physicians, sometimes myself included, initially didn't want to get the vaccine because of all the politics around it. And it had an absolute mistrust of everything. Then until I did my own research and then realized, wait, this is a huge big deal. This is good. This is our way out. So I also received both doses of the Pfizer vaccine. And I encourage all of my parents to get the vaccine, to sign up and get the vaccine. Just as our infectious disease doctor just spoke, we have ways that you can remain safe. Mask up is a big thing. Wearing your mask, physically distancing, and following the information that you guys have provided for safely reopening schools. It is crucial for the mental health, for the academic health, for physical health for our kids. I have seen some kids are gaining up to 50 pounds just in the last year. I am desperate for our kids to get back out to school.
Thank you.
Thank you for that question.
Yeah, thank you. We're going to have plenty of time to go even deeper. I think, Dr. Coffin, talk about those vaccines and what we've learned from the trials, and talk
Sure.
to, there was a lot of concern about how quickly everything went and a lot of the politics, and but talk about that scientific process and why you think the vaccines are safe and effective.
Right.
And going well.
First, let me just acknowledge it was impossible not to be a bit skeptical about the vaccines as we learned about the process and it was advertised as Operation Warp Speed. Who wants a medical intervention to be developed at warp speed? I get that we needed it developed fast, but we needed to be developed safe and well. That said, I really do believe this has been developed carefully and well. A couple of things that I've learned that really have helped me feel comfortable saying that are first that although this is the first time this very specific type of vaccine has been used, it's been studied extensively for over 15 years. So this is the first time it's gone into commercial vaccine, but it has a long track record of being studied. And that's one of the reasons we were able to catapult and move so quickly into human trials. I think another big thing has to do with the way in which it was made. This vaccine didn't require us to grow astronomical amounts of this virus in vats and then kill it and then test it for complete killing. Just the way that this was made, we just had to construct a small part of the virus, and that was enough to give it its power to produce immunity. The other thing that happened is there was unprecedented engagement by our communities and by Chester, as we just heard about Penn's effort to engage and to bring in people from throughout the country in all communities to participate. And so within the order of 2 to 3 months, over 40,000 people had received the Pfizer vaccine, and another 30,000 had received the Moderna vaccine. I don't know of a more kind of huge example of volunteerism, particularly during this critical time. Now, if we fast forward to where we are right now, this vaccine has been rolling out at a quick pace, but that quick pace actually benefits people who haven't yet gotten the vaccine. If it's your turn to get a vaccine, you can look backwards and say, oh my God, 40 million people have already gotten this vaccine, and we are not seeing or hearing anything about a concerning safety signal. After 40 million people get a vaccine, I really do believe we would know if there was a concerning safety signal. There are some questions about people having allergic reactions, and the process of delivering the vaccine has been set up to keep all of us safe in that process of getting the vaccine. So I think kind of coming full circle, despite the Operation Warp Speed name, I think this is a good and really important way to both protect ourselves and our families, as well as contribute to our communities and bring us closer back to life as we used to know it.
Thanks, Dr. Coffin. Dr. Messam, talk to us, what does COVID look like in kids? Like, what have you seen in your practice? Are we really worried about the kids getting COVID? I know we're not going to be vaccinating them for a while. What's your thoughts about kids and their own risk from COVID?
So the kids run the gamut. They can be positive and have literally no symptoms. And the way I find out is because they have a parent in the home who is positive, and so the whole family gets tested. But then there are some kids who get cold symptoms. They get a fever. I've had patients get the dreaded MIS-C, multi-system inflammatory syndrome in children. I have had a couple children who are hospitalized. Most of the kids are thankfully doing okay right now. But again, some of them a fever, some of them runny nose, some of them absolutely nothing, and then a small percentage get very ill.
And what's yeah. And so in that context, to families out there that worry about sending their kids to school, does that concern you, or do you feel like the safety protocols, as you've seen them through your own experience, how do you think those protocols have been working for you in terms of the safety assessment in terms of kids going to school?
So the safety, those protocols work beautifully. I have many patients who are in private school, in parochial schools in the county, and they have been going to school 5 days a week, and they're all required to wear masks. Mm-hmm. And they are doing beautifully. Actually, not one of those children have developed COVID in my practice, as long as they're following the protocols. Yeah. So wearing a mask is crucial, and so many adults don't want to wear a mask. And I just want to encourage everyone who is listening. Kids feed off of us as adults, and I tell parents, if you have a bad attitude about it, the children will have a bad attitude about it. If you wear your mask, and there's so many different masks now, they can choose their character that they want on the mask. If you wear a mask and it's not a big deal for you, the kids will follow suit. They mirror what we do as adults. I have a ton of masks that I keep in my office. And when they come in and they don't want to wear it, I have them choose their character. And they keep those masks on unless there's a parent who feels offended that I'm asking them to wear a mask. That's when I run into trouble with the kids. But I think with the safety measures, with the physically distancing, with the masks on, the kids are doing beautifully.
Can Dr. Messam say that again, Dr. Rubin?
Okay, go ahead, Dr. Messam. We were asking for an encore there, I think, Dr. Birks.
Perfect. So wear your mask, physically distance, and you will be safe in school. And the kids will be happier.
Thank you.
Yeah, I think that's always the trade-off. When we looked at this statistically, in terms of the number of kids with severe complications who are in the hospital, first of all, those rates are coming down now, which
very
is
low,
which is really important. It's 15 per million.
Mm-hmm. Yes.
And so it's extremely low. And so it begets the question, Dr. Hannam, you probably are seeing the sicker patients, right? Because you're an adult internist.
Yes.
I think families are trying. I think most families have come to accept that the kids, like we've seen, are at very low risk of severe disease, but they worry about their own family members, the grandparent who takes care of the child. Or how would you counsel families in terms of, particularly with adults at home and multi-generational families living in households, to kind of protect themselves while their kids are going to school?
Yes, that's another great question, Dr. Rubin. And many households may only have one restroom, and the houses are relatively small, so there's a lot of contact. And certainly we want to encourage hand washing, frequent hand washing for at least 20 seconds, and we like to encourage again the social distancing when possible at home. And also, frequent sanitizing of common areas like the restroom and the kitchen, and frequent deep cleaning. It is a good idea to have frequent testing for COVID-19. at least a couple times a month. I'm proud that there are many locations in Chester where testing can be done. The city of Chester has sponsored multiple COVID-19 screenings, and then also at the Chest Pen Clinic and now recently at the Everest Urgent Care Center, COVID-19 testing has been it's been successfully done for thousands of citizens in Chester, and frequent testing. And of course, when there is a positive, you want to do the contact tracing as well. I have to give kudos to the Delaware County Council and the Chester County Health Department, and particularly Ms. Rosemary Halt, who has been critical in developing some of these screening programs and implementing the contact tracing. That's very important.
So thank you, Doctor. And with that said, I just want to thank the city of Chester and their work as well. And before we move forward, I just want to acknowledge that our mayor is here. And so our honorable mayor, Mayor Kirkland, and we just want to give him a few moments to have a few words. Distinguished Mayor, let's give a round of applause for Mayor Kirkland. Thank you so much.
Thank you, Dr. Burke. First of all, let me apologize. I'm not as technically astute as all of you, so it took me a little while longer to get on this link, this Zoom conference. But I appreciate all the work that you, the school district, and CHOP and others have done to contribute in the effort to minimize and alleviate this COVID-19 virus. I do want to say that I appreciate the efforts of not only the school district, but the efforts of people like Rosetta Carter and Livia Smith and Councilman William L. Jacobs, who heads up our health department. The sooner, well, let me say this. We have vaccinated over 500 some persons within City Hall, and we've been working with Crozier Hospital in conjunction with Miss Gwen Smith, a nurse at the hospital, to administer vaccines, and we've also been working with Silvercare, Dr. Lee and Dr. Chang, to, and of course, Dr. Hannam, to do our testing for the virus. So I appreciate this conference. I appreciate the Zoom call. The sooner we get vaccines into the arms of all of our residents, the sooner we alleviate this disease. And I look forward to all of our children being able to come back to school, not just our children, our educators, our janitors, our administrators, each and every one. It's important to all of us. And so this is a great opportunity for us to do just that. And I want to thank all of you for your efforts thus far.
Thank you, Mayor Kirkland. Thank you for being such a great partner and supporter of Chester Upland School District and to our efforts. So we thank you so much, and we're just so honored to serve with you. Back to you, Dr. Rubin.
Sounds good. Hey, Susan, I wanted to pick up, Dr. Coffin, I wanted to pick up on a part of the conversation we were having there with Dr. Hannam, because I think while we know that the kids don't get very sick, right? And that we do know they can transmit the virus. We do know that schools can be safe. We have these great protocols that use masking, that try to keep these classrooms not too densely crowded, lots of hygiene. And then we talked about testing from the perspective of adults. We didn't talk so much about testing from the perspective of schools. And how do you plan on positioning testing to kind of help even reduce risk even more?
Well, I think one of the kind of extensions of the idea that children don't get terribly sick is that children can slip through the cracks of even the most diligent parent screening before they go off to school. So you've probably been hearing about, before a child goes off to school, they need to be carefully screened, make sure they're feeling their very best, no fever, no stuffy nose, no new cough before they go. But the truth is that sometimes you can have an asymptomatic infection with this virus. There's a potential role for testing, though, where if it's done consistently on a group of patients, like Dr. Hannam mentioned, we can reduce the risks posed to a community or to a school through introduction of asymptomatically infected people. I think another thing as pediatricians working in Philadelphia, both Dr. Rubin and I noted, is that sometimes it's really hard for a family to get a child who may be sick tested. And that's given rise for us working with some schools in this region, including the Chester Upland schools, to try and develop protocols where children who develop new symptoms of coronavirus can easily get tested at school, so families don't have to pick up a sick child from school and then spend the rest of the day racing around figuring out who would be willing to take a test on this 6-year-old. And so therefore, I think schools actually are emerging as an important place where rapid testing can really help both keep the communities, school communities safe, as well as build confidence that it is a safe community.
That sounds good. I mean, we're getting some questions that are starting to come in terms of, around the role of vaccinating teachers and students, and certainly how we're going to get the teachers vaccinated. I think we're very, that is about to happen. I think one of the reasons you saw the CDC sort of suggest that we didn't need vaccines to get kids back to schools because we have such an amount of data now about the safe experience of kids returning to school with the other layers of masking. But I also know that we still remain, even among our teachers, a lot of hesitancy out there, Dr. Hannam. And I know that there's just so much misinformation. We're living in the age of social media, and there's just a lot, the vaccine can cause the disease, that they're implanting something in you, all these crazy theories that have become popularized and mainstream. I'm just wondering, as an internist, when you have someone who is identifying their anxiety around the vaccine for things that are clearly misinformation, how do you talk to your those people who are really hesitant and not coming from a place where they have facts?
Yeah. Well, we do know that communities of color are 2 to 3 times more likely to become infected, and then to have serious complications and have a higher death rate. So the communities of color have been impacted disproportionately, and there is a lot of hesitancy in the community regarding prevention and treatments for COVID-19. And I think the best approach is to be a good listener and show compassion and show concern, that their fears are legitimate, to the sense that historically there has been some problems, as you mentioned, and you try to be empathetic and kind of talk it out, and give as much evidence, as much clinical evidence that we have. You try to give that to the patient, and try to allay their fears. And you might not be successful the first conversation. There may still be some hesitancy, but you can certainly follow up in the near future with additional conversations about the same. And as you mentioned, with 40 million individuals being vaccinated, and certainly less than 1% are having bad outcomes. So as time goes on, as the numbers increase for those vaccinated, it may be more palatable for more people. We do know that anywhere from 30 to 40% of people have a hesitancy. they're either not sure or they really just don't want it. So, it may take time to allay their fears and make them feel more comfortable.
Thanks, Dr.
Thank you, Dr. Hannam.
Oh, I was just going to say that, I've thought a lot about this with folks who, this hesitancy goes deep. It goes to our nurses, our staff. It goes to certainly teachers that I know as well too. And I think, I've sort of taken it as to acknowledge it and try to understand their fears. If you're friends with folks, you could rib them a little bit, and tell them, they're part of the family and you want to get them too. But I think the biggest thing for me that I've seen is helpful is now there are 40 million people who have gotten the vaccine. And one of the things that I have found helpful, and discussions of race are always really hard. Who's jumping to the front of the line and who's getting those vaccines, right? So you not only have 40 million experiences, but who's being left behind and who's not on that line right now. And when you recognize that, it sort of tells you, it's a little bit different than the history that we talked about. And often it begets a really honest conversation about who really needs to be at the front of the line, given the impacts. And that's just something I've observed. And it's been helpful in having really sort of kind of breaking past the barrier and the surface of that. I know I've had a lot of success with some of my friends and some of the folks who work in my own office. Sophia, I heard you chatting out there. What do you got for us, Sophia?
Hello, I just wanted to make sure that we're extending ourselves to the community. We really wanted this to be a time of engagement so that we can hear concerns and questions and that we could address them. So we asked as people registered that they would send questions and if they had questions, and we have a few. So I just wanted to take the time now to read those, if that's okay. Okay, the first question is, teachers are at such a risk right now of getting COVID from children due to the nature of our jobs, especially with the return to everyday face-to-face in-person instruction. Yet it's next to impossible to get a vaccine. How do we get more teachers vaccinated faster? More specifically, how can we get them in the arms of Delaware County teachers faster? Anyone on the panel can take a stab at that.
Well, I know it's very, very close that, I think that the inventory, we all know that there's been problems with inventory in terms of getting enough vaccines out to get folks done. I think there's so many groups that need to get done all at once. You got also the elderly folks, the grandparents out there, and the folks with chronic conditions, and it's all about having enough vaccine. I do think that's going to really considerably change in the next few weeks based on the reports I'm hearing from Department of Health. And so, we've initiated significant vaccinations of teachers throughout the Philadelphia County. And I suspect we're just a couple of weeks behind in terms of moving along. But the biggest thing, moving along in your region as well too. And so I think this is changing almost every day, honestly, now with the new vaccine shipments. But I will say the biggest thing that's helping the community right now is the seasonality of this virus. It's declining, and it's declining very quickly. And if there's fewer individuals in the community who have virus, because we're moving into spring, that's probably the safest protection. And then you add the masks, you add the distancing that we're doing in the class, the hygiene, the testing that we're making available through the ACID program. And you have pretty sufficient there, protection. And you can't totally eliminate risk, but it's done really, really well. And we have experience not just in the suburbs, but just in cities now that these programs can work extremely well. And I think these programs work with these barriers, multiple layers that they'd all have to fail for someone to get sick. And that includes our teachers. And what we saw in the fall was we'd occasionally see student-to-student transmission. We more often saw teacher-to-teacher transmission. You usually let down your guard with the people you know the most. Your friend, you stop for a coffee break, or you meet up with them after work, or you go out on a weekend. And so it's, it still remains mostly the transmission risk in terms of the significant risk is among adults. And to remember that, and we've been counseling the district to be very careful about how adults move through the building, making sure everyone's wearing their mask, encouraging to stay spaced out, keep it their distance from the kids. I mean, a quick pat on the shoulder or a quick hug is not going to transfer the virus, but sustained immediate contact, and just to remember those basics. And we've been doing that since March. I remember the first day that we came back in our office. Our office is in Philadelphia over on Market Street. I'd say our staff is about 2/3 individuals of color, who had lots of risks themselves and within their own families, and we were all terrified. But a couple of weeks of wearing those masks, kind of staying distant, and we're seeing kids with COVID, right? And I'm in usually these tiny little rooms because I think they put us in those little rooms, Dr. Messam. I think they put us in those little rooms so that the kids can't really get around us, and we're trying to give them the vaccines, right? But we're in these little exam rooms for 15 minutes, and through just the protocols of the masking and hygiene, none of our staff has gotten COVID through an office transmission. It's that kind of protection we're delivering to you. And as the vaccinations come, run and go get them, because we're working hard every day to make sure the teachers are going to be able to line up.
Okay, thank you, Dr. Rubin. Another question, we have a couple of questions in regards to the vaccination and will it be mandatory? That's one thing. And then children, and will that be mandatory for children to have the vaccine and to come back into in-person? So right now, can someone on the panel speak to where we are with the clinical trials in regards to children, and maybe what is projected in the future, what that looks like or may look like? Dr. Coffin.
Yeah, I'll be glad to answer that. So there are a group of pediatric infectious disease physicians like myself all across the nation who are just beginning to study how effective the two major vaccines, the Pfizer and the Moderna vaccine, are in people under the age of 16. And this isn't because we doubt that they're going to be effective in people who are younger than 16, or that we're concerned that they're going to have unusual or unexpected side effects, but it is the way that we systematically ensure that we are doing right by people of all ages, of all colors, of all walks of life, is to make sure that we're testing and demonstrating efficacy and safety in each group. So right now, there are trials that are going on that are focusing on teens. Next, we'll see trials that are focusing on younger school-age kids, and then finally on children under 5. There are many families who are eager to have their children enrolled in these trials. I was just on a conference call where one of my colleagues was very excited that her teenage son was able to be enrolled in one of these trials out in Kansas City. And I think that we will be getting these data in the probably next 2 to 3 months would be my best guess, and begin to see the ages of people eligible to be vaccinated fall. The question about children, making this vaccine mandatory for children and linked to school entry is an interesting one. Vaccine mandates for school entry have been an important way to make sure kids get their shots. And I think there's probably going to come a time when the coronavirus vaccine is just one of those vaccines, and it will get eventually looped into our regular vaccine mandates. But my sense is that won't be anytime soon. Right now, we're really still in the throes of making our entire community safe and bringing everybody up to a level of good immunity.
Thank you.
What I can say is that we would highly encourage it instead of mandating it.
I really like that phrase. Yeah, strongly encourage it. It would be the very best thing to do for yourself and your family. But yeah.
Okay, and then there's
I think that people in general are smart. I think I'm encouraged by the way public opinion is changing. I do think it's changing now that more vaccines are getting out there. You're seeing those numbers start to rise as people see their neighbors benefit from the vaccine. Now, certainly they've heard about some of the achiness and the flu-like stuff for 24 hours, but my hope is that as we continue to move further along, that people see the value with their own eyes of just how quickly this thing is getting better. And I think it's important for us to message to that while the numbers are going to get better, some people might see the numbers this summer and say, well, it went away, but this is a seasonal virus. You can expect it's going to be back in the fall. And so I think, that's, so people should not be swayed like, see, I got away with it. I didn't get a vaccine, because it'll come back just like the flu comes back. And if you were unexposed this year, you could possibly get it next fall as well, too. So I'm hopeful that that people are going to see with their own eyes the value that we've seen the last few weeks as we started to really vaccinate and really bring these numbers down.
Okay, and another question asks, should someone with multiple comorbidities get vaccinated, such as lupus, heart disease, hypertension, hypothyroidism, sleep apnea, obesity, and prediabetes?
Yes. Yeah, absolutely. Absolutely. Many of the comorbidities you mentioned increase the risk for complications from COVID-19, or even just being a smoker. In Pennsylvania, if you're a cigarette smoker, that puts you into the 1A category. And no matter what your age, it makes, no matter what your age as an adult, it puts you in line to get a vaccine sooner rather than later. So comorbidities are definitely important to screen for and to prioritize as far as when you should get the vaccine.
And I want to add to that, how many cases have we seen where a child is left alone because both parents have died from COVID, or there are multiple family members who've died, and now the child is all by themselves. By immunizing yourself, you not only protect you protect all of those people that you love. So important. And so I get a lot of the questions, but I have asthma, that the shot is going to make me sick. And I'm like, no, you need to get the shot because you have it. So just lots of education and reassurance that they're going to be okay.
Dr. Coffin, on the flip side of that, when would an individual want to maybe consult with their primary or be a little cautious to get the vaccine?
Sure. There are a small number of people who have had allergic reactions to this vaccine. And it's unusual to have this, and it doesn't seem to be linked to an allergic reaction to other vaccines. But if you've had an allergic reaction that's serious enough that you had to go to the hospital for, that's a time you need to talk to your doctor before you get the vaccine, just to review what it was that triggered that allergic reaction, because we now understand what part of the COVID vaccine people are sensitive to. And so if you spend some time with your doctor talking about what caused your allergic reaction, they'll be able to tell you, yep, go ahead and get the vaccine, not a worry for you. Or perhaps they'll say, let's have you be one of those incredibly rare people who shouldn't get the vaccine.
Thank you. So I see we have, I think, 2 participants with their hands up. So I'm going to ask Jennifer if she could unmute them so that they could ask their question directly to the panel, if that's okay at this time.
Karen, go ahead.
Maybe they're not there anymore.
I have a question about where teens can get vaccinated at this point, since they can get only the Pfizer vaccine. Where are they able to get the vaccine?
Susan, you want to answer? I know we have
Yeah.
we have begun vaccinations at CHOP for select groups of older youth. Susan, you want to talk about that?
Sure. So Only teens who are 16 and above are eligible to receive any of the vaccines. And right now, teens in that age group who have a serious underlying health conditions, and those are heart disease, diabetes, sickle cell disease, kidney disease, and cancer. If you have one of those 5 conditions and you're between the age over 16 or over, you fall into the group that's currently being invited for vaccination. Children's Hospital of Philadelphia is vaccinating their patients that are of that age. If you don't happen to be a patient there, I think you should talk with your doctor about the right way to be referred to a place that is vaccinating older teens with those conditions. Maybe Dr. Messam can talk about what she's been doing with the teens she cares for that have some of those underlying health conditions.
Well, in Delaware County, we really are having a problem finding vaccines for even adults sometimes. I recommend that they go, for some of my special needs patients with medically complex, I've gone onto the websites and signed them up. And then they just have to check their emails frequently, because I tell them, if you don't check your email and you miss that call to schedule an appointment, it will be gone in a very short period of time. So I signed them up and I just have them keep checking their emails. But we just don't have the availability for some of the vaccines right now. So we're like in one of that time period where they have to wait for a little bit. And I know that will change soon, but it's very anxiety provoking for some of the families.
Now, I'm going to clarify, because I believe, and we'll double check this. Sophia will follow up with Chester Upland. I believe all kids 16 to 18, in the region in Pennsylvania, not in Delaware, who meet those criteria that Dr. Coffin said can obtain their vaccine if they're over 16 years of age through CHOP. And there's a website to enroll. Sophia, you'll follow up on that. This was a conversation that played out today with Nemours.
Okay.
Because, as an allocation to within the quote state hospital system, CHOP was given sufficient vaccine, not just for its own patients, but for other individuals in the community that may not come to CHOP in that 16 to 18 age group, the kids with chronic conditions that we talked about, so that they could receive their vaccinations. This was just a conversation I had today. We'll follow up and clarify that and make sure we get that website over to Dr. Birks and the folks over in Chester.
And me.
Yes, Dr. Messam. We'll keep you in
And
the
Dr.
loop as
Messam,
well.
and we won't forget about you, Dr. Messam. Of course.
Thank you.
Yeah, so as we prepare for students, I heard Dr. Birks say that the Chester Upland School District will be opening their doors next Tuesday. There's a question in the chat stating, do you recommend mask breaks for students in the classrooms? If so, how long is considered safe?
So this is Dr. Coffin. I'll address that because I've had a chance to talk a lot, particularly with schools in Philadelphia about this question. I think one thing I've observed is almost all kids have learned to wear masks for a lot longer than we ever would have expected. I mean, when all this started and somebody said, I think a 3-year-old can wear a mask, I was like, no way. Mm-hmm. But I was wrong. 3-year-olds can wear masks, not everyone, but many of them can. Similarly, I don't think that we need to introduce the idea that there must be a mask break, but I think we do need to have them available. And so I think it's good to think a little bit about when is an appropriate time for a mask break. So I think it needs to be under pretty controlled circumstances. So when the class is all settled down and everybody is in their seat, there needs to be attention paid to, kids can't be swiveling around in their seat and turn into their neighbor behind them. And I think that they need to be short. I don't think people need a 15-minute mask break, maybe 2 to 3 minutes, just to kind of take a deep breath, if they've got a little sweaty under their face, wipe that down. And I think then pop it back on. I think we've all gotten so used to wearing these things for so long, or for much longer stretches than we ever expected, that we don't need to build in an expectation that it needs to be only with breaks.
Thank you. I see another question, and it's a lot of discussion around ventilation in schools. And this question states, if fans are effective in reducing the spread of COVID, will classrooms be equipped with fans? So if we could have someone to address this that we're hearing so much about.
This is Dr. Coffin again. I'll make a couple of comments and then I'll turn it over to Dr. Birks to talk about the specific plans for Chester Upland. So one of the really important messages that I hope we're successful at conveying is there's not any one safety measure that is important to have, but rather to have multiple ones working simultaneously. And the fact that we've got multiple ones gives us protection if one of them is not present, because we have 3 or 4 other ones to keep us safe. The question about fans is really not so much, is there a fan, yes or no, but rather, is there circulation of air? Is air flowing? And the reason that's important is because movement of air helps dilute any particle of virus that happens to get out into the air. And so the way I like to explain it is, if you were to take a gallon of water or a gallon of milk and put a single drop of blue food coloring into it and then swirl it around, that's a lot like what's happening when we move air around. We disperse it and dilute it to the point that it can't cause any problems. Just the same idea with airflow. So sometimes a fan might be introduced, other times a door might be opened, all things that can help air move. There are a lot of schools that have a natural advantage of being in the South where it's warm and they can have their windows open all the time. They don't need fans. Other schools have been able to use their existing ventilation systems and just turn up the amount of ventilation that's happening. Nobody really knows that the intervention has been done, but it can be very successful. And even in very old schools, I was at a school 2 weeks ago in Philadelphia that was reported to have no ventilation. We were standing there talking about how to keep children safe. And I watched a little bright yellow piece of paper flutter. And the reason that it was moving back and forth was because there was air moving. And again, that's really all we need is air movement to help stir and dilute anything that happens to end up in the air. So I just want to leave people with the reassurance that you don't have to see a fan in a room to know that you're going to be safe.
Yeah, you said you always tell me, Dr. Coffin, just cracking a window or keeping the door to the classroom open is often enough, right?
Yep, absolutely.
Dr. Birks, you're on mute. I don't know if you're trying to speak or not.
So I just, I want to share that we had an air quality study conducted back in the fall, and we had environmental engineers come in and have deemed our schools safe. And so additionally, we have people who have requested accommodations for basically accommodations in terms of ADA. We have purchased dehumidifiers for them, as well as some of our windows that we know don't open in schools. We ordered additional dehumidifiers, and some of them are in district now, and we have some that are on back order. So we are addressing air quality, but just for the record, and I want to make sure I say this publicly, our schools are safe. And I said, we had a third-party vendor come in, so it wasn't Dr. Birks because she doesn't have this area of expertise. Someone else does, but there is a comprehensive air quality study that's on our website as a part of our Ready to Learn and Accelerate plan. And similar to what Dr. Coffin said, we've put multiple mitigation strategies in place to keep people safe in district in terms of following all the CDC protocols and guidelines. So that's our response as a district to that question about air quality.
Nice. Okay, so another question that arose. They said, thank you for discussing issues with vaccination, but I am still unclear about when we teachers might get vaccinated. Could this be clarified? And if someone, I guess, maybe could speak on the phases and how teachers fit into the phases and what's happening now.
Yeah, I'll be clear. I think, if we had more vaccine being delivered to the state right now, I think the teachers would have already received their vaccines. They ran into problems. The storm last week in the country slowed things down a bit, but there's a third vaccine that's being approved now as well too, and they're anticipated to greatly increase the shipments of vaccine. I don't work for the health department. I can't speak for the Chester County Health Department, but they're doing everything they can right now to expedite the delivery of vaccines. If you are a teacher who has a chronic health condition, you may meet criteria today for signing up for a vaccine, because even though they're not prioritizing all teachers, they are the health departments are trying to get the teachers who do have health conditions to the front of the line to help assure that they can be safe as they return back to school. But I suspect within the next 3 to 4 weeks, this is really going to loosen up, and that we're going to be making plans to get teachers start to get their vaccines as we move here into March and towards April.
Yes, and then if I could just chime in to piggyback on Dr. Rubin's comments, this weekend it's likely that the Johnson & Johnson COVID-19 vaccine should be approved by the FDA for the emergency use authorization. And they already have 4 million doses on standby, ready to go out. And by the end of March, there should be 20 million doses distributed in addition to the Pfizer vaccine and the Moderna vaccine. So, and as you know, the pharmacies are gearing up to distribute the vaccines, and of course, you do have to get on their list and you have to go online to register. But in the next week or two, the vaccine should be more readily available at the chain pharmacies as well.
And if I could just say one more thing, it's, we have the vaccines, just as Dr. Coffin said, it's one layer on top of another on top of another. So yes, you get the vaccine, but you want to mask up, you want to physically distance, you want good hand washing, you want to have hand sanitizers, and it's the combination of things that will keep you safe. So it's not one specific thing. It's not like I got my mask, my shot, so now I can take my mask off. It doesn't work that way. And I only recently got my shots. So we in the office were using masks constantly, good hand washing, trying not to overlap patients. We were doing things, and thankfully none of us have gotten COVID.
Thank you, Dr. Messam.
And Dr. Messam, I assume that you've cared for quite a number of children who actually have ended up being infected. And so those measures were able to keep you safe for a whole year.
Yes.
Even seeing children over and over again with coronavirus before you got your vaccine.
Yes. There were many times when they came in, they were not symptomatic, but then the next day a parent was ill and got tested, and then the child is tested and the child was positive. So yes, we're exposed constantly.
Yeah, I think that's such a powerful story, that someone who spends, all day, every day, seeing sick children, oftentimes with sick parents, go through an entire year doing things carefully and diligently, but keeping themselves and their entire office staff safe.
Yeah, I also want to say too, I talk to folks, I say, we design these solutions very much in line with what we have in our own offices, except now with the addition of a testing program, I think our teachers were adding another layer that most of us who work in healthcare don't have, which is the assurance testing for all the staff that we're planning to build with the program, and the extra testing some of the students to give you another layer of safety that we don't even have. And we've been safe in our offices without that testing throughout the year.
Thank you. So we are going to just start to wrap up our panel discussion. And if in just 1 to 2 sentences, if each panelist could leave some final remarks on what they would like the community to know, could you do so at this time? And then we will turn the program back over to Dr. Birks and close out. Dr. Messam, would you like to go first?
Oh, sure. So I guess I want to say that as teachers, you are so valued. You are so important. Your health is important. Your kids miss you in class. Your role is essential, not only for academic reasons, but for numerous supportive reasons. I miss you being in the classroom. And I hope that you understand that we're with safety features in place, that you can get back out there safely. I know that you want to, and you want to do so safely. And we're going to do whatever we can to help you do that.
Dr. Hannam, would you like to go?
Yes. This is a time for hope and a time for optimism. As Dr. Rubin mentioned earlier, many of the data, many of the parameters are moving in the right direction. The weekly incidence rate in Delaware County and in Chester is below 100 new cases per 100,000. And the positive rate for testing is around 5 or 6% in Delaware County and in Chester City. So those numbers are significantly lower compared to just 2 or 3 months ago. Hopefully that trend will continue. We'll see. But with the mitigation efforts and the many layers that were discussed tonight, I'm confident that the Chester Upland schools and other schools in the Chester area can have in-person education safely for the teachers, for the staff, and for the students as well.
So I guess I'll quickly offer a few final comments too. My thoughts are, we are at such a better place than we were at this time last year. We know what to do. We know how to do things. We're kind of used to it. And we've got the resources to do it. And I think the thing that we don't all have is a lot of experience stepping back out into this new world where we just are getting used to being a little more bold, sending our kids to school, going to work ourselves. And it does take a little bit of courage to cross the threshold the first day. But I think that you'll find as you send your child off to school, as you enter a school building, that you'll be reassured by what you see. Kids know what to do and how to stay safe. And the schools have been set up to help teachers and staff keep safe while they do what they really love to do and want to do. And so I wish you all the very best. And I hope that the rest of the school year is a great one for Chester Upland.
Yeah, and I'll just finish by just saying that that crossing of the threshold after a couple of weeks of doing this and seeing that these protocols are working and getting and learning from them, and you start to feel safer at school, or in our case, in my practice, than I do when I'm walking through the market sometimes. And that's the kind of confidence we hope that you'll all have as you get used to your protocols in the school. We're here to work with you. We're here to make it as safe as possible, and we wish you all well in Chester, and continue on the journey to get back to normal. And we'll get there.
I want to thank Dr. Rubin, Dr. Coffin, Dr. Messam, and Dr. Hannam. Let's give them a round of applause. Thank you so much for sharing your gifts and your talents with us and providing us with more insights as to how we keep each other safe and debunking some of the misconceptions about what's happening in the medical field and about this virus. I know many of us are still a little nervous and anxious at this time, which is understandable. However, as a collective community, I would dare say, like Dr. Hannam said, I have hope, I have optimism, and I have belief that we can come together as a collective community to bring back all of our learners and keep them safe. There's so much research that suggests that in-person learning is vitally important for students, not just their academic growth and development, but as well as their social, as well as their emotional growth and development. And teachers are the greatest lever in impact and student achievement. So to our teachers, in honor of Public Education Week, yes, we thank you. We thank you for your commitment. Thank you for your service and your sacrifice to all of our learners. Well, we need you. We need you every day. We need you every hour. And our children, most importantly, need you. Dr. James Comer from Yale University said, no significant learning can take place unless there's a relationship. And relationships matter. Relationships, relationships, relationships. Our students need you to give those ear high fives and those smiles and all those things that we have to do through those masks right now to make sure they feel a sense of connectedness and belonging so that they can be successful in school and life. For every parent, please go read our Ready to Learn and Accelerate plan, which is on our website. It talks about masking, recess, all the protocols and answers that you'd like to know about having your child return to school. We make this appeal to our families who selected the hybrid model of you're in cohort C. We love to see you on next Tuesday. And if you selected cohort U, we love to see you on Thursday and Friday. And Wednesday, the superintendent's kind of remembered to remind everyone that we are virtual, but we really need you back. Learning is important. And I'm so excited when people ask me, well, what do you do? And I always say, I'm in the learning business. I love learning. And as a community, we're working together to keep everyone learning so that we're empowered to make a difference for our children. And so for all the children learning, we're looking forward to seeing you and your bright and shiny faces as we return to school. I want to thank Dr. Marin, as well as Ms. Collins, for convening this panel. Let's give them a round of applause. Hard work in having us come together for this conversation. We are going to also air this on our Facebook, and I didn't realize so many people watch us on Facebook, but we are going to make sure that this is posted on Facebook. To our teachers and our staff, we are proud and excited that we're going to roll out our ACID testing. And so we will phase that testing, so you will receive information from us, but we need you to participate. We surveyed you. You said this is what you wanted. And so we are responding to what you've asked for, that you don't have to go down to Crozier. You don't have to go to Upper Darby. You don't have to go over to the city of Chester. No offense, Mayor, but you can go right down the hall to Stetzer or to Main Street or to STEM or to Chester High School or to one of our other schools and get tested. Isn't that exciting? So we will provide you with more information because we want to keep each other safe because we are one Chester and we want to keep our community together. We also have a public service announcement of the importance of vaccinations. And as we know, there's research that suggests, and our doctors told us quite eloquently, because I'm Dr. EDD and they're doctors MD, but they told us quite eloquently that people of color are not getting the vaccinations at the rate that we need to. And so we have a public service announcement from one of the icons in this community who had a vaccination, is doing just fine, because it keeps giving me more work. Let's listen to our public service announcement.
I just received my first COVID-19 vaccination shot. I'm excited about it, and I want everyone under the sound of my voice, please, 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 as soon as the opportunity presents itself, please come out and get your vaccination. I traveled through the snow today because I think it was that important. So I want to thank the city. I want to thank Crozier, everyone who had anything to do with this. This is exciting. God bless. Thank you.
Let's give it up for Dr. Bond and Mr. Johnson, our board president. They had their vaccinations. So it's possible. They're here and they keep giving a whole lot of work. So we know that everything is fine and that we encourage each of you to take all the steps, testing, masking, vaccinations, because we need you. We believe in you. We need your gifts. We need your talents. We need you here in our community. So I want to say thank you. I want to thank my team and all your hard work. And collectively, again, community, this is my appeal. Please, I implore you, our children need in-person learning. They need it. They need it for a whole host of reasons. It's been a year. All the loss that our students have had academically. Yes, our teachers are doing a good job, but as we know, there's so many studies out there that talks about in-person learning and the importance of it. So everyone at the sound of my voice, please, we need your support. We need you to share, follow our guidance, read those guides. I know that it's a 135-page document, but trust me, we put it all together because Dr. Birks believes in right brain and left brain thinking. And so sometimes you need to see the word and you need to see the picture. And so that's why we did that, so you can read all this information. So again, I thank everyone. Enjoy the rest of the week. Well, we have one more day left. It'll be Friday. We'll have a weekend. So thank you very much. And I'm honored. And to our doctors, you are officially now members of the Chester Upland School District family. So you are not a stranger. And I'm sure that Dr. Coffin and Dr. Rubin can attest to now. I think they've been in Chester quite a few times. So we consider you family. So we're going to call upon you all the time to come support us. So thank you.
I look forward to being able to come and see everyone in school.
Yes.
Rather than in Zoom.
And have a fantastic evening, everyone. And thank you again. And thanks to all the board members. Thank you so much for being here this evening. Thank you. Have a good night, everyone.